Welcome, everyone. Ready for another deep dive.
Ready to go.
Today, we're tackling something that's surprisingly common but often misunderstood: Fuchs dystrophy.
Yeah, it's something that we see quite a bit in our practice, and
It affects about 4% of people over 40 in the U.S., which is a pretty significant chunk of the population.
yeah, and a lot of people just aren't aware of it.
We're diving deep today, armed with some interesting research, so let's get to it.
Sounds good to me.
So first things first, what exactly is Fuchs dystrophy?
Well, you know the cornea, that clear front part of your eye. Think of it like a window. And at the back of that window, there's this thin layer of cells called a corneal endothelium. These cells are like tiny little pumps that work tirelessly to keep your cornea clear.
Okay, I'm visualizing those little pumps working away.
Exactly. Now, with Fuchs dystrophy, those pumps start to malfunction. It's like their batteries are slowly dying, and they struggle to keep up with removing excess fluid.
So the cornea, our window, gets cloudy.
Yeah, you could say that. It's like a sponge that slowly becomes waterlogged, and that swelling eventually messes with your vision.
And this is where it gets a little tricky, right? Because the early signs can be so subtle.
Absolutely. You might just experience blurry vision in the morning, but then it kind of clears up throughout the day.
Like that morning eye feeling, but maybe a little more persistent.
Right, exactly. Most people don't even think twice about it. They just figure they need another cup of coffee.
Yeah, not, oh no, my corneal pumps are failing. That's a scary thought. How many people are out there walking around with these early signs and they have no idea?
It's more common than you'd think, and that's why we're talking about it today, to raise awareness. Recognizing those early symptoms is really crucial for effectively managing this condition.
Early detection is key. I'm already sensing a theme here. So we've got these malfunctioning corneal pumps, not exactly the kind of breakdown you want happening in your eye, but what causes it in the first place? Is this something you're born with, or is it a blame it on your lifestyle situation?
Well, it can be a bit of both, actually. Genetics definitely play a role.
Okay, so if your parents had it, are you doomed?
Not necessarily doomed, but your odds do go up. If one of your parents has Fuchs dystrophy, you have about a 50-50 chance of developing it too.
50-50, huh? Talk about a coin toss. Thanks, genetics. So anyone listening who knows it runs in their family, should they be hitting up the eye doctor right now?
Panicking won't help, but yeah, regular eye checkups are definitely a good idea.
Right, it's not a guarantee, more like a heads up to be proactive. But what about the rest of us without a family history? Are there other things we should be watching out for? Those secret culprits?
Definitely. Your lifestyle choices, especially when it comes to certain habits, can really impact your risk.
Let me guess, smoking is on the naughty list.
You know it. Remember those tiny blood vessels we talked about? The ones that deliver oxygen and nutrients to your cornea?
Yeah, keeping those little pumps going strong.
Exactly. Well, smoking is like slowly choking those blood vessels, damaging them over time. And guess what? It actually doubles your risk of developing Fuchs dystrophy.
Wow, that's pretty alarming. Definitely makes you think twice about lighting up. Anything else we should be mindful of?
Well, maintaining a healthy weight and managing conditions like diabetes can also make a big difference.
So genetics, smoking, weight, diabetes. Sounds like a recipe for healthy eyes gone wrong. But what if someone is listening and they're thinking, okay, maybe a few of those risk factors sound a bit too familiar. What should they actually be looking out for? We talked about the subtle early signs, but what happens when things start to get a bit more obvious?
Well, as Fuchs dystrophy progresses, those little hints can turn into something you can't ignore. One of the first things you might notice is a gritty sensation in your eyes.
Gritty, like you've got sand stuck in there.
Exactly. It can feel like that. Or like having an eyelash stuck that you just can't seem to get out. And that's often paired with an increased sensitivity to light.
So suddenly, sunglasses aren't just a fashion statement anymore.
Exactly. Bright lights might seem way too intense, and you might find yourself reaching for your shades more often, even on cloudy days.
So you've got gritty eyes that are super sensitive to light. Sounds like your eyes are sending out an SOS. What happens when you go to the eye doctor with these later stage symptoms? What do they even do?
Well, the eye doctor basically turns into an eye detective. They'll ask you a bunch of questions like about your medical history. Do you have any family history of eye conditions like Fuchs dystrophy? Have you noticed any specific symptoms? And if so, for how long?
So they're building a whole case file for your eyes, and then I'm guessing the high-tech gadgets come out.
You got it. They might use something called a pachymeter, which sounds kind of intimidating, but really it's just a way to measure the thickness of your cornea. It's painless and easy.
So they can actually measure that waterlogged sponge effect we were talking about.
Exactly. It's a way to see how much the cornea is swelling. And they'll probably use a slit lamp too, which is basically a superpowered microscope. That lets them get a really detailed look at the front part of your eye to check for any telltale signs of Fuchs dystrophy. They're looking for things like tiny blisters on the cornea called guttae.
Kite, like little blisters on your eye. Not exactly the kind you want popping. So what do those mean for treatment?
Think of guttae as little clues for the doctor. They help figure out how far along the condition is. But the good news is there are definitely treatments to manage Fuchs dystrophy, especially if it's caught early.
Right, early detection. There's that theme again. What are some of the things they can do in those early stages?
Early on, it's all about managing those symptoms and slowing down the progression as much as possible. They might give you some medicated eye drops or ointments to help draw out that excess fluid from the cornea.
Okay, so pretty simple solutions. Although I have to ask, I've heard some interesting things about using hair dryers. Is that really a thing?
It sounds strange, I know. Some eye doctors recommend it on the cool setting, of course. You hold it at arm's length and gently dry the surface of the eye.
Wait, hold the phone. People are aiming hair dryers at their eyeballs. I'm a little terrified even hearing about this.
I know, it sounds wild, but it can actually help evaporate that excess moisture. And there are other things they can do too, like therapeutic contact lenses. Those can help create a smoother surface over the cornea and improve vision.
Wow, it's amazing how many options there are these days. But what about more severe cases? Like if those early interventions aren't cutting it?
Well, in more advanced cases where vision is really being affected, they might have to consider a corneal transplant.
A corneal transplant. That sounds pretty intense.
It is a major surgery, for
Yep.
sure. But it's important to remember that it has a very high success rate. For people with advanced focus dystrophy, it can be completely life-changing.
So even in those later stages, there's still a lot of hope. But I imagine, like with any procedure, there are some risks involved.
You're absolutely right. It's all about having a balanced perspective. For example, some treatments, like steroid eye drops, can be really helpful. But long-term, they come with their own set of risks, like increasing your chances of developing cataracts or glaucoma.
It's a balancing act then, weighing the benefits against any potential downsides.
Exactly. And that's why it's so important to have those open conversations with your eye doctor. They're the ones who can help you figure out the best plan for you, depending on your individual needs and how far along your condition is.
Solid advice. It seems like we covered so much ground today on Fuchs dystrophy. Everything from those easy to miss early signs to all the different treatments available. If our listeners take away one thing from today's deep dive, what should it be?
Don't wait. If you're worried about Fuchs dystrophy, even if you're not experiencing any symptoms yet, talk to your eye doctor. Knowledge is power, and it's always better to be proactive when it comes to your eye health.
Couldn't agree more. Early detection can make all the difference. Thank you so much to our expert for guiding us through this deep dive on Fuchs dystrophy. And to our listeners, remember your eye health matters, so be kind to those peeper. We'll see you next time for another deep dive.